Yep, good.
This is about the time here.
Shorts and t-shirts on, or no shirts, and I'm wearing a sweatshirt. I'm thinking, man, it must be getting old. I swear.
That can't be it. Okay, I think we can call this meeting of the Warsaw Redevelopment here. Do I have start off with the pledge of allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Once again, I want to, in another meeting, I thank everybody for their thoughts and prayers during my dilemma, and it's good to be back, so I thank you for all. We'll start off with the approval of minutes from the last meeting. Thank you guys for being here, getting through that.
I make a motion to approve.
I'll second.
Bill's made a motion. Who seconded? Joe. Joe seconded that. All in favor of approving the minutes as presented, signify by saying aye.
Aye.
It's unanimous, all right. Okay. New business. Jeremy, I think we have a.
Yeah, so, like a little bit of what we discussed last month, you have in front of you an economic development memorandum of understanding.
For those of us who weren't here last month, could you just maybe recap?
Yeah, I'm gonna go through it.
Okay.
This MOU is with 8404 LLC and is concerning, the possible placement of a VA clinic out by where the two Parkview buildings were built. In discussions with this group, the city has talked about giving, as part of our participation, $1 million towards the construction of that project. That project would involve building a VA clinic next to the two Warsaw, or to the two Parkview facilities out there across from Meyer. I think it's roughly, say, around 15,000 square feet, a little over almost $11 million project. City's participation would be capped at $1 million, and then how we get that money funds into that project is also outlined in here. We'd be doing what we've done in a lot of cases, which is buying and disposing the property back to them. We would not necessarily be buying anything from Parkview, we'd be buying it from this LLC. So I think that's a point of clarification. We are not buying any property from Parkview, we'd be buying it from the LLC. The LLC is a veteran-owned business, as is required by the VA. And we got some of the end of care and their partners here to talk about the project if you have any questions.
Do they own the property now?
They do not, they would be buying the property from Parkview, a portion of the property.
Okay.
Jeremy, a question I had, in looking at, the condition that we're gonna require, is that, there is a definitive lease agreement with the VA. And, I'd like to hear a little bit more about what we can expect as a binding agreement.
Yes, and so this is just an MOU, so there's no, obviously, guarantees. There are steps that we would have to take to finalize that. This is just kind of the first step. And obviously, one of those steps would be before we would execute the actual disposition of funds into the project, would be that they would have a signed lease agreement with.
Yeah, I understand that. What I'm trying to get at is with your experience, who does that come from? Does it come from the Veterans Affairs? Does it come from the federal government somewhere else? And you know, I'd really like to know.
Hi, Andrew Stevenson, 8404 LLC. To answer your question, the government puts solicitations out nationally. Multiple developers bid on those. They've accepted our proposal. The culmination of that is signing the lease agreement with the Department of Veterans Affairs. It is just getting to the finish line with those guys. We are the successful party bidding. So same questions that they have. We're talking about designing the building, things like that. And those are the final steps with the VA.
What type of lease, term of lease is there?
This will be no, this is a 15.
Yeah.
I think it's a 15-year lease with the federal government, starting from the completion of construction.
And we'll follow up to confirm that.
Yeah.
Yeah. So Jeremy, assuming it's a 15-year, is that adequate for our purposes?
It's 15 years. Have you done this before?
Yes, sir. Yeah, we started up in Upper Peninsula of Michigan. We've been around the Midwest. We just wrapped up one about almost double the size in Cincinnati with in partnership with Cincinnati Children's Hospital. Big group down there. They've got friends at Parkview as well. So it's kind of a rinse and repeat of what we just did down in Cincinnati, having Parkview on board as well.
Any idea how many employees you're looking at?
Yep, so that's interesting. Greater than 60, probably more in the 80 ballpark. The VA can be a little bit funny with the way that they do patient care. There may be more staff present than they see patients in the building because they do a lot of home care, a lot of telehealth, different things like that. So yeah, there will be quite a bit of services provided beyond just what the physical space can do.
Has it been your experience since you've done this before, most of those employees end up living in the community? They're not
Certainly.
traveling nurses or traveling doctors or?
Correct. This isn't going to be contract work. I don't believe the VA does that, or at least it's not been my experience that the VA does travel nursing or anything like that. They have a very robust federal program for bringing employees on board. I'm sure they're going to be marketing the Warsaw area. And then also, you know, within the VA network, there might be providers that live a little closer to here that are already commuting, so they can reorganize some of their people that way too.
Where's the closest VA hospital?
You got to travel a bit. So you're heading towards Mishawaka, Fort Wayne. There are even some services they'll send you to Marionville. So this greatly reduces the travel burden on people in the community. It also helps with the budget of the VA too, because something not everybody knows, but when you travel to those appointments, they pay you mileage. So by keeping some of the money back in the pot in the community for this clinic, that's another way that the VA saves a little bit there too.
I think an important thing to add to, you guys asked about a past history. We did not think this would take this long to get the award. We're still finalizing the lease itself. No terms are changed in that. It's just basically the legal language on timing, because we want to make sure we sign off on something that we fully commit to on timing purposes. We have been involved in the other 3 buildings in the medical hub. Mayor Gross and Jeremy have been great to work with, previous mayors. We finished about $60 million across the boulevard, I guess you'd call it. We actually thought the VA would come first. So Drew and I are business partners. He's a majority owner because he's service disabled, veteran owned, which is a federally recognized company. But we obviously were involved in some other things across the street or the boulevard. So we finished other buildings. We're excited to bring this to the site because we think holistically it works very well there. And we're hoping to get this thing going because I know there's some people in this room that we probably thought this would happen 4 years ago. So we're really close. From a decision making, Drew deals with the contracting office, which is an office that makes decisions on lease contracts. The Fort Wayne VA hospital's involved, and then there's engineers, which are involved, I think, sits in Marion. So we're communicating with all those folks. We also have been fortunate, Congressman Yakum and some of Jackie Leworski's old staff have helped us along the way, because I think everybody's been a little confused on why this has taken so long. Drew and I think submitted a proposal.
Was it tail end of 23, start of
Yeah.
24?
So part of the city's commitment here has really helped us keep things cost effective. The concern was that they weren't, they would throw it out and we'd be back in another 3-year cycle. So we think we're there. We think we'll hopefully get a sign off here very soon from the VA. And then obviously Jeremy's been great to work with, and he's understood the challenges. So he'll be the first person to call to make sure he knows of the timelines and those kind of things.
So just for clarity, this is a veterans outpatient facility. It's not a hospital, it's not an inpatient facility. And you'll offer physician visits, rehabilitation, what else?
So we're dividing the building. I don't know all the specialties that would be in there. The VA does not come into town without primary care and mental health. We're gonna cover those bases first. From there on, you've got things like audiology, perhaps some prosthetics fitting for diabetic patients. It'll all be relatively routine, things can be handled in an outpatient center. It's not designed or licensed for any overnight stay or anything like that. But it would be a way to augment the bulk of the services that our patients or veterans are having to travel to go see.
And the neat thing in that immediate area between the two hospitals that support the town, the veterans get a lot of services. It could be dental care, orthopedics. There's 2 great orthopedic providers in this city. You're within stone's throw of all of that. So one of the things that Drew is always challenged with, his proposal is probably 1,200 pages long for each one of these clinics, and they ask about like where food services are, is the area safe, is there not things that aren't conducive to VA healthcare. So he's showing these maps and really, in this scenario, we were fortunate enough to really understand what the medical hub meant and the progress that was gonna be made there. So we were pretty early on putting that proposal out, and we do feel like it's the best site in Warsaw for what they're trying to do, and it's highly visible, as you guys know, for US 30.
With your proximity to Parkview and Lutheran, other than purchasing the property from Parkview, do you have any affiliations, contractual affiliations with either of the facilities?
No, we do not. And then the VA perhaps would for tertiary care, for things like that. But 8404 does not partner with either hospital group, strictly providing federal buildings, and then the VA that has contracts to partner with those people.
All right, thank you.
Yes, sir.
Did you build the building, the physicians building across the street?
Yeah, so I think you guys are seeing how these healthcare facilities develop. We built for the independent physicians, O&E. Obviously, we're developers, so one of our biggest strategic advantages is bringing capital. The physicians did not want to own that, at least through the construction process. So they asked us to get involved to be basically an intermediate between Parkview and them. Because the physicians have things like cost controls in mind. They're not always, perception of quality isn't the facade of the building, it's actually the services they're providing. So the physicians there at O&E were very involved. Lori Pagan, their practice manager, was, she's something special. She knows how to run a budget and hold it to the expectations. And we like that, because if we can hold budgets and timelines, that's where we're successful. Time kills all of our deals and carry costs are real. So the O&E physicians were great to work with. So yes, we do own that building. We paying taxes on it. We also negotiated what we thought was a good thing to, the medical community there pays taxes. So the building Drew's doing will pay real estate taxes, which undoubtedly will fund what we're trying to do. So the projects we were involved in, we did not ask for any increment on our building. we were hopeful that we could get ours going, pay taxes, and help out trying to control the VA timeline and budget, so.
Those buildings are very nice.
Thank you.
Well done and controlled. Any other questions about, it is a memorandum of understanding, so.
One thing I forgot to bring up, and I forget her first name, Mrs. Robinson. Martha. When we went on this journey, the Robinson Construction Group was very community focused. It wasn't just about their property. At first, I was a little thrown off by that because a lot of people that have property for sale is about selling property. We found out that Martha and the family had grown up there before US 30 was even president. So there's a lot of history here. Martha's recently passed. She drove the site. We showed her the master plan, the VA, the Robinson family, obviously, were a part of this. And I do want to give them a thank you because none of this would have happened if they didn't foresee what we were trying to do there. Because these projects always take longer than what people anticipate, and they've been very patient. So she walked the property, I think, a couple of years ago, or at least drove it, and she was a part of signing off on this. So we really appreciate the opportunity they gave us here. So.
That's really nice to hear. I appreciate hearing that.
Did you have another question?
I think most of my questions have been answered. Joe asked what I was curious about, affiliation with other hospitals. I didn't want to find ourselves showing any favoritism. I'd like to hear what you think, Jeremy, bottom line.
No, I think we met with NFCare in this development 2 or 3 years ago, and the conversation we had was the city was not going to participate in any of the medical, but we would participate in the VA, because the reality is the VA is providing services to veterans of Kosciuszko County, reducing their travel time, increasing their accessibility, getting their health care speed increased, and their ability to receive that care in a quicker time frame. And then the location was important to us because both hospitals are readily accessible. So if you're receiving medical care from them and you have an emergency or need to be taken to a hospital quickly, whether it's Parkview or Lutheran, both are accessible within minutes.
And that's patient choice.
Patient choice, yes. Yeah, that doesn't have anything to do with them. And whatever their provider, whatever the VA, let me rephrase that, VA choice. Point is, they are seeking VA healthcare. Whatever the VA has allotted for that, that's up to the VA. But really what it comes down to is us providing those services that our veterans need. Rather than having, right now they're either driving to Fort Wayne or Mishawaka.
Is scheduling done locally or through Fort Wayne?
Actually, you take your choice. It can be done from your phone on an app. You can reach out through a healthcare portal, same as any other hospital group, schedule an appointment. What's convenient about that is, say we're down the road a little bit, the clinic's opened up and there's not an opening right away, but someone's willing to drive, they have that option to get sooner care. So there's agency at the veteran level too.
And just thinking from the veteran standpoint, as far as accessibility, is this gonna be a 5-day-a-week clinic?
Yes, Monday through Friday. Some oddball things that could happen, maybe the guard needs to borrow it to give shots before everybody goes out on deployment or something like that. That's one of the oddball things that would happen, but.
So our lease says the business hours are that. Obviously, the VA decides at the end of
Sure.
what they're doing. I do want to, Drew is a veteran, he's on TRICARE, which I don't know if there's any other veterans here, but you guys probably know what that is. So he knows a lot more than just a developer. So some of the things he's speaking to are not part of the construction or development financing, are what we see as, phase 1 of 3 phases of the medical hub. It's him because he uses the system, and obviously has navigated it. And it's sometimes can be difficult, definitely if facilities are outside of your town.
So thank you for your service.
a motion to approve the MOU?
I do.
I'd be honored to make that.
Okay, Joe's made a motion to approve the MOA.
If it's good enough for Joe and Martha Robinson, Jeremy,
I love it.
We have a first and a second. Call for the vote, all in favor, signify by saying aye.
Aye.
Those against, nay. Okay, unanimous.
Thank you very much.
Yeah,
Thank you, Jim. Thank you for coming.
kudos to Jeremy and both Jeff and Joe for the time you guys, I know, put into this. We appreciate that. So, how about the annual financial report?
Yeah, so the rest of this meeting is pretty much us just meeting our obligations per the state statutes. You have the 2025 financial report from the Warsaw Redevelopment and Warsaw Redevelopment Authority. So feel free to peruse that as you may, but what is in here would be the board members for 2025, any employees of the commission for 2025, all the balances, revenue and expenditures for 2025 for each district. I also have included the Warsaw Technology Park in this report, but it's not germane to the actual TIF report, but it's in here just because you guys oversee that budget as well. So my intent all these years has been this acts as two things. It meets our statutory obligation from the state, but at the same time, it also allows you to use this as we start our new budget for 2027 in the next 2 months. So you can use this as reference as we put those budgets together to see what we did in 2025, what we're doing in 2026, and what the future of 2027 holds. So you'll have both the 2025 expenditures, you'll have the 2026 budget in here, and then each district outlines the projects, construction projects that may be ongoing now, construction projects that we've completed, construction projects we expect. It also has the debt, any debt service for that district. So you can see for the Northern TIF District, all of our debt services associated with that district. It has the revenue and the budgets for the last couple of years, and then it has 2025 expenditures. And then it has a little bit of a forecasting of revenue and funds available over the next 2 years, so 2026, 27, and 28. Obviously, we're in 2026 now. It gives you that outline of what our debt obligations are, what the revenue is, what our project costs could be, and then just kind of a bottom line look at, as we will also be presenting before June 15th, we're required to disclose whether or not we pass through any TIF. So that's in here as well, on whether or not we would pass through any TIF in any TIF district. So each TIF district has its own kind of little plan, so you can go through there. I don't think a lot has changed from the previous years. Obviously, the 2 residential TIF districts are picking up a little bit of momentum, but it'll be interesting to see how the recent tax changes impact those. So keep that in mind. I do expect there will be an impact in those districts. But obviously, if you've had any chance to look at it, I'll be more than happy to take any questions now. Otherwise, feel free to continue to review it and then meet with me anytime you need to discuss it.
Jeremy, you alluded to one of my questions about the impact of property tax reform on the residential side.
Yeah.
Have you woven into any of these figures potential over the next 3 years of property tax losses and their impact on the TIF districts?
I haven't. I expect there will be an impact. I don't think it will be a significant impact. All the districts are continuing to grow, so I think what's gonna happen is we just won't have as much cash as we anticipate or would like to have had, so our growth will be reduced. Because we are growing faster than what the tax cuts would impact us. Now that could change, but as of right now, the other side of that coin is technically the Northern TIF District. A large portion of the Northern TIF District, which is generating the largest amount of cash, is gonna expire in 4 years anyhow. So the reality there is there's gonna be a large impact one way or the other, regardless of the tax changes.
The other thing I noticed in the tech park, we're up to about $4.5 million of increment received, and I know it caps 5 million.
Yep.
I know that a few years ago, the legislature looked at that, and offered, continuation, not what we're getting now, but do you recall, what we might expect beyond that 5 million?
Yeah, I believe, the last time I checked, it was either 150 or 250 a year, but then you have to regenerate that, so you'd be starting off at a basis of 0 again after you cap out of your 5 million. So you hit your 5 million cap, and then you get reset to 0 at that
So you
amount.
have to
and-
continue to
but
grow.
then you have to grow that next
Got it.
allotment. And I know that they've tried changing that, and I've had some conversations, so I think we'll keep trying to push, that envelope a little bit. But it's, the IDC's gone through some changes here
Yeah.
recently. I know that has been handed off to a different branch, so it'll be interesting to see how the program, looks a few years from now, but, we weren't necessarily anticipating any additional funds outside of the 5 million, but we're certainly going to put ourselves in a position to continue to receive funds if, as long as there's funds to be received.
Oh, I know we will. Thank you, sir.
Yep.
Appreciate it.
Any other questions about the financial report? Did a great job, Jeremy, as usual.
We can either do the claims or we can do the presentation next, it doesn't really matter. As you know, part of our other requirement is that we hold a public hearing. All the public has shown up.
Hi, Jeremy.
Great support, hi, so this was sent out to all the taxing agencies, that we would be giving this required presentation that they're so heavily anticipated being present for. But we can run through it pretty quick, or we can do the claims and then run through it, it doesn't really matter.
So we'll do it now, right?
Whatever, it's up to you. Practice.
You wanna do it now, or you wanna do it after?
Works for me.
Okay.
Pretty simple, really. So the intent of presenting this is, the state wanted to make sure that we were presenting to the taxing agencies what the potential impact of TIF is. Unfortunately, that's a very convoluted question, right? For a variety of reasons. We'll go through some of that. So really what this is supposed to do is talk about how the TIF impacts tax rates. Most of you know what tax increment financing is. We're basically collecting or capturing, we set a base, so when we create a TIF district, the current value in that district has a base, and then as that district grows, we collect their increment that's generated over that base, up to a certain time frame. That time frame has changed a number of times over the last 20 years. Originally it was 30, then it was 20, then it was 25. So it changes. Any given year, that time frame could be different. Most of our districts are in that 20 to 25 range. I think the original Northern TIF district was on a 30-year one though, but that has since, the 30-year time frame has changed, so. So you can kind of see the base, we collect the increment, and then all TIF districts expire. There used to be legacy TIFs, the central, the downtown TIF district was originally a legacy TIF that didn't have an expiration date. Back in 2015, the state did away with legacy TIFs, so even that.
Except Indianapolis.
Except, they still have it, I thought they did away with theirs too.
Well,
But-
at the time, they didn't.
Yeah, at the time they didn't, I think they went back a year or two later and did, but either way.
Not that it bothered me or anything.
No, it bothered all of us, but.
Why not?
But, so all TIF districts expire at this point. So when we talk about what is a TIF impact, there's a variety of different impacts it can have. Tax collected, tax rate, what impacts taxes collected could be job creation, commercial and residential growth, income, sales, tax, payroll taxes collected, et cetera. All of those have an impact on different taxing agencies, as some taxing agencies collect different things. For example, innkeeper's tax, that gets collected in a different method than what property taxes get collected. So when we say what's an impact of creating a TIF district, there's a lot of things that we don't necessarily control that we do generate additional revenue in. So when we create a TIF district, for example, the technology park, and then we create 800 jobs in that technology park, that revenue from those income taxes goes to a lot of different agencies that is not collected as part of TIF. So saying that whatever the property tax impact of that TIF is not a clear picture of the overall impact that we're having when we create new developments. The TIF percentages has stayed pretty level. I mean, we're continuing to grow. That's a lot of that's the Northern TIF district, but you're gonna see that drop pretty drastically in 4 years. So right now, you can see our TIF percentage has increased over the last few years, but come 2030, that's gonna decrease quite a bit. So how do you quantify the impact? The old way was if no TIF, no development, no taxes generated, right? So a lot of what we're doing with TIF districts, we're taking undeveloped property, and we're creating new opportunities. Or we may be taking underdeveloped property, i.e. GACI, and turning it into Union Station Loft. So those are the two primary things that we're trying to accomplish with TIF districts. In theory, if we do nothing, nothing occurs. If we don't have a Winona interurban TIF district, then GACI doesn't happen. If we don't have a northern TIF district, then the $5 million we put in the ground that created the tech park doesn't happen. So that's one way that we can quantify the impact. But just creating those new buildings, which is the property tax side, doesn't necessarily mean that's the only thing that's collected. It goes back to depending on what you're doing. You've got sales tax, you have income taxes, innkeeper's tax. All those things are impacted by the things we do in these TIF districts. So there's more that factors into a TIF district than just the property taxes that we're collecting off of the new development. So when we're factoring in all those things, you get what I call the TIF margin, which is associated with that revenue. So no TIF, no development, so you can kind of see adjusted net AV versus AV as TIF. This is a good thing because it should be doing what we're trying to accomplish, which is to create growth, right? So if our TIF districts are not growing faster than the rest of the city, then we're not doing our job. You can see that a lot of the things that we've done within our TIF districts have created a lot of the growth that the city is seeing, as it's grown 84% since 2020 versus just the rest of the city not in TIF district has grown 38%. So we're having a huge impact on what the future will hold as those TIF districts expire. So when we start to look at what that TIF margin is, what the impact is, it's important to not just look at the increment. It's easy to say, oh, well, we're generating, a little over $4 million. That's the impact. But then you factor in what happens to all the economic development projects we've done. You take those out that have been based on TIF revenue. Then you're basically cutting that in half. And then, oh, by the way, what happens when you factor in all the income taxes we've generated that are going to a lot of different tax agencies? That has an impact as well. So you can't just look at the whole $5 million that were collected in taxes, or $4 million that were collected in taxes. It's a lot bigger picture than that when you factor in those other taxes that are generated. So you can kind of see that's the northern TIF, Winona interurban, and the marketplace. If you go back a few years, we were generating less than $30,000 a year in that Winona interurban. With the marketplace project and the Union Station Lofts, we've been able to grow that TIF. But those projects were TIF funded, So without those projects, you have no revenue. Northern residential TIF continues to grow a little bit, so we've got a couple of projects that we've been working on. Obviously, we did our first RIF bond for Bella Augusta Phase 5. So once again, it goes back to us creating opportunities with the TIF. Without that TIF, there are no opportunities. Same thing with the Southern TIF. We're working on some projects down south with the Park Ridge. We put about 1.8 million in a lift station. Without those TIF revenues, without those TIF driving that, that project doesn't happen, those homes don't get built. At the same time, we're talking about what we're generating. We're also talking about what the impact on the adjacent taxing agencies would be. You're really looking at what their max levy versus their certified levy is. Because their max levy is what they can collect, max, and their certified levy is what they do collect. So when we're talking about what the impact on any one taxing agency would be, you have to take both of those into consideration. If I'm a taxing agency and I can collect up to $100,000, and I can collect up to $100,000, and I collect $95,000, then there's only a $5,000 gap. So if we were to pass through any revenue that we're currently collecting, only the gap would get collected. Does that make sense? So when we look at what that impact is, it's not simply comparing dollar to dollar. So if I don't collect TIF, then all those dollars go to the other agencies. That's not the way it works. If we don't collect TIF, those dollars do not necessarily go to the other agencies. So when you look at the total levy gap versus the increment, all we're doing is losing $5.1 million of revenue. We're not giving $5.1 million of revenue to other taxing agencies because they have no means to collect those taxes. So it's simple for a lot of people to pick on TIF and say, hey, you're impacting this or you're impacting that, or you're taking money from us. The reality is if their max levy is X and they're collecting up to their max levy, I could pass through as much money as I want and they're not going to collect more than what their gap is. So if their gap is $2, they're gonna collect $2. So you can kind of see what the gap has been over the last 2 years versus what our increment collection has been. So this is just more of a kind of high level the way I view TIF and what we're trying to do. At the end of the day, if we do our job and we use TIF properly, we're going to have a long-term impact on the growth and development of not just the city, but other taxing agencies and their ability to collect revenue. As we create jobs, that creates housing, that creates commercial, and all of those things work together to grow the tax base. And as we grow that tax base, and we do it successfully, and we grow faster than our needs, then we continue to keep downward pressure on the tax rate, which we've done a very good job at over the last 2 decades of keeping our tax rate at a very even keel. And part of that is by creating these new development opportunities. When we roll off a TIF district, the intent there is it's going to have a drastic impact on our tax rate, and that tax rate will continue to stay down so that we can continue to grow, meet our needs, and keep a very consistent tax rate. TIF allows us to do that. It's a long-term play, it's not a short-term play. Obviously, they have a lifespan, but if we do what we set out to do within these TIF districts over the 20 years, we will generate more revenue that will impact all the taxing agencies in the future and help keep not only our tax rate at a nice even keel, but also help keep their tax rates down. And that's my requirement per the state.
I think for some people. Well, I mean, just so they get this. I mean,
There's my article right now.
I didn't know who he was talking to.
okay, well, that was pretty good, thank you. Now the approval of the claims.
Alright, we got a few. The first three, NIPSCO, Indiana American Water, and Indiana American Water, are from Mars, 131.44, 399.73, 154.32. GA Consultants, 6,738 for the County Farm Road Sidewalk Project. Barnes and Thornburg, 3,757.50 for legal services, for scooters. Eastern Engineering, 1942, is our copier fee for the month. Dirtworks, excavating 9,800, sewer expansion, for Enterprise out by the Airport Industrial Park. Visa 192 is our go-to meeting subscription. DLZ 5,046, the airport park design. American Structure Point 4,807.18, Anchorage Road construction inspection, for that ongoing NDOT project. And engineering resources 3,204 is the on-call engineering services, for millworks on Husky Trail. That is my on-call agreement with Aaron Ott. Since he's left the city, we still need engineering services, so I continue to work with him to try to wrap up some of the projects that we have in the works. As the new city engineer transitions in, we will taper that back, but for
Are those,
now,
inspection services?
that's for Anchorage Road,
Oh, okay,
for the NDOT project that has started construction
got
and
it.
made a lot of people happy. It'll make them happy when it's done, but they're not happy at the moment. Any questions?
So where are we on this County Farm Road project, Jeremy? I know we need to approve the claim, but before we wrap up, can you give me
They provided me originally, a couple months back, they provided a rough outline of it. We made some comments, we met with the school, we gave them some feedback. I've asked them over the last month where we're at, and I have not received a update at this point, other than that it's in review. So they're doing their own internal review before they give us the documents. So I'm hoping we'll get that here shortly.
Will we be able to see that?
Yes.
Have any input on
Yes.
that? That's in my district.
Yeah, keep in mind, this is just a study, so yes, there'll be a lot of input. And the point is, the biggest issue is the crossing and working with the school, because they are supposed to be researching and designing or looking at what would be the best possible crossing, safe way to cross children into the school. So that's one of the major tasks of this study, is to look at that and then be able to meet with the school and figure out the best solution for that, as well as getting the cost for the project. Once we have that cost, then we can start to figure out when and to what extent the first project will look like. There's drainage issues as well, but all of that's being done as part of the study.
There's drainage issues everywhere.
There always is.
Say this. Any other questions about the claims for today?
Make a motion to approve as presented.
Okay, Joe made a motion to approve the claims presented. Bill seconded that motion. All in favor of approving the claims as presented, signify by saying aye.
Aye.
Motion carries.
That's all I got.
All right.
I make a motion to adjourn, unless we want to hear from our audience.
Speak.
Tech has no comment.